94% of miscarriages at age 44 have one cause, and it is not something you did wrong. I'm Dr. Handan. I'm an obstetric gynecology and fertility specialist with 25 years of experience and over 10,000 patients. I help you understand your body step by step so you can make your next right decision with clarity, not with anxiety. Understanding what is happening to your body does not make the loss smaller, but it can replace guilt with clarity. That is what this video is for. If you want a structured, science-based fertility roadmap, Fertility Master Circle is my free online community where I teach you to understand your fertility step by step. The link is below, but right now let's talk about what age actually does to your fertility, because most of what people hear about this is incomplete. And later, I tell you why IVF cannot fix something that most people think it can. But first, let's start at the beginning. I also built you a worksheet for this video. Download it below and follow along. Women are born with all eggs they will ever have. This is one of the most important facts in reproductive medicine. Eggs are not produced monthly like sperm. You start with a fixed number at birth, and that number only goes down. Here is what that looks like across lifetime. Before birth, a female fetus has around 6 to 7 million egg cells. By birth, that number has already fallen to 1 to 2 million. By puberty, around 300 to 400,000 remain. By the mid-30s, the decline starts to accelerate, and by menopause, fewer than 1,000 follicles remain, whether any eggs were ever used or not. So, when we talk about age and fertility, we are talking about two things changing at the same time: quantity and quality. Quantity meaning how many eggs you have left, and quality meaning how healthy those eggs are chromosomally. Both matter, and both decline over time. In my clinic, the most common thing I hear is, "I did not know this was happening." Now you do. Quantity versus quality, not the same thing. And normal AMH result does not mean your fertility is fine. This is one of the most common misunderstandings I see, and I want to clear it up directly. AMH, anti-Mullerian hormone, is a blood test. Anti-follicle count is an ultrasound measure of how many small follicles are visible in your ovaries. Both measure egg quantity, meaning how many eggs could potentially be retrieved in an IVF cycle. But the American Society for Reproductive Medicine states clearly, age is a much stronger predictor of reproductive success than ovarian reserve. AMH and anti-follicle count tell us about numbers. They say nothing about chromosomal health. Egg quality is about whether the egg has the right number of chromosomes, and there's no blood test for egg quality. We understand it mainly through age, embryo development in IVF, and in some cases genetic testing of embryo. So, a normal AMH at 40 does not mean you have 24-year-old eggs. It means you may have reasonable number of 40-year-old eggs. That distinction matters. I have had patients come to me relieved because their AMH was normal. My job is to make sure they leave with the full picture, not just the part of the fields reassuring. How fertility changes with age, the real numbers. After age 37, the fertility decline accelerates faster than most people expect. The decline does not happen overnight. It is gradual, but the rate of that decline is not constant, and knowing where the acceleration points are helps you plan. Here, the approximate monthly pregnancy chances by age group based on population data. In your 20s, around 20 to 25% per cycle. Early 30s, around 15 to 20%. Mid to late 30s, 10 to 15%. Around 38 to 40, closer to 8 to 10%. After 40, often below 5% in both natural conception and IVF. These are population average. Two women of the same age can have different fertility. These numbers describe trends. They do not predict your individual outcome. If you are 34 reading this data matters differently than if you are 41. The biology is the same. What you do with it depends on where you are. Miscarriage risk and chromosomal errors. Most miscarriages are not caused by something you did. They are caused by chromosomal error in the egg. As eggs age, errors in chromosome separation become more common during cell division. The result is embryo is with the wrong number of chromosomes. Most first trimester miscarriages are caused by exactly this. Here is what the data shows by age. Under 35, approximately 10 to 15% miscarriage risk. Between 35 and 39, around 20 to 25%. Between 40 and 44, around 40 to 50% miscarriage risk. 2024 study over 7,000 natural conceived miscarriage found chromosomal abnormalities in 67% of cases overall. By age 37, that number was 79%. By age 44, it reached 94%. The full citation is in the description below. This is biology. It is not a reflection of anything you did, how healthy you are, or how regular your cycles are. I have sat with patients after a second or third miscarriage who blame themselves completely. The data almost always tells a different story. It was never their fault. What IVF can and cannot do. Earlier, I promised to tell you what IVF cannot fix. Here it is. IVF does not fix age. And here's exactly why. IVF retrieves more eggs per cycle. It gives you more embryos to work with. And that does increase your chances of finding one chromosomally normal embryo. That is real and it matters. But IVF cannot improve the quality of the eggs themselves. In women under 35, approximately 28 to 40% of embryos tested in IVF have chromosomal abnormalities. In women over 40, that rises to 60 to 70%. At age 44, more than half of all IVF cycles produce no chromosomally normal embryo at all. The limiting factor is the egg, not the uterus, not the IVF process, the egg. This is why IVF success rates fall with age for the same biological reason that natural conception does. IVF is one of the most powerful tools we have. I use it with my patients every day, but I also make sure they understand what it can and cannot do before they start. Does male age matter? Does male age affect fertility? Yes. Here's what the research shows. Men continue producing sperm throughout their lives, so the decline is more gradual than in women. But after 40 to 45, sperm volume, motility, and DNA quality all starts to decline more noticeably. Higher sperm DNA fragmentation means damage to the genetic material inside sperm. Think of it like a book where some pages have tears. The text is there, but the message is harder to read. This kind of damage is linked to lower embryo quality and modestly increased miscarriage risk. If a man is over 45 or if there is already a male factor diagnosis, it is worth discussing sperm DNA fragmentation testing with your doctor. That said, female age remains the dominant factor in overall pregnancy success. Can supplement reverse egg aging? Coenzyme Q, DHEA, and dozens of other supplements are marketed to women trying to conceive. Here's what the evidence actually shows. No supplement has been proven in well-designed clinical trials to improve egg quality in a way that meaningfully increases pregnancy rates or reduces miscarriages. We do not have strong evidence for that. Some may support general mitochondrial health, but they cannot turn a 40-year-old egg into a 25-year-old egg. The marketing in this space moves much faster than the science. I know many of you are already taking these, and I also prescribe them. I always warn my patients that we don't expect miraculous results from these supplements. These support your overall health, reduce whole body inflammation, improve ovarian blood circulation, and may improve follicle development. Not only supplements, but I also emphasize the importance of lifestyle changes like stopping smoking, limiting alcohol consumption, improving sleep quality, exercising habit, eating habits, and stopping recreational drugs or weed, avoiding microplastics and heavy metal containing meals, and weight management. This is a whole package. This may improve something in your body, but I am asking you not to replace a real evaluation with a supplement routine. 4 myths and 3 steps. There are 4 things many people believe about age and fertility that are simply not accurate. Myth 1. My AMH is normal, so age does not matter. Not true. AMH tells us about egg numbers, not chromosomal health. A 40-year-old with normal AMH still has 40-year-old eggs. Myth 2. IVF will fix everything. Not true. IVF is a powerful tool, but it cannot improve egg quality. Success rates fall with age for the same biological reasons. Myth 3. I feel healthy, so my eggs must be healthy too. Not necessarily. Egg aging follows its own biological timeline independent of how you feel, how fit you are, how regular your cycle are. Myth 4. 35 is a cliff. Everything changes overnight at 35. No, the decline is gradual. Age 35 is a threshold used in clinical guidelines to recommend earlier evaluation. It is not biological cliff. Many women at 37 or 38 conceive naturally. The numbers describe population trends, not your individual outcome. Now, let's make this practical. This is where your worksheet helps. Step 1. Write down your age, how long you have been trying, your typical cycle pattern, and any known diagnosis. Step 2. Talk to your doctor about a few baseline tests: AMH, ultrafollicle count for ovarian reserve, TSH and prolactin for thyroid and hormonal baseline, a semen analysis for your partner, and a pelvic ultrasound. Step 3. Know when not to wait. If you are between 35 and 40 and have been trying for 6 months without pregnancy, get evaluated. If you are under 35 and have been trying for 12 months, get evaluated. If you are over 40, do not wait at all. Consider evaluation now. And if your cycles are very irregular and there is a known condition, earlier is always better. Earlier evaluation does not mean there is definitely a problem. It means saving time. And in fertility, time matters. If you have not downloaded worksheet yet, do it now. I built it using the same evaluation framework I walked through with my own patient. If you were sitting in my clinic right now, this is exactly what I would ask you to fill in. If today's video helped you understand your situation a little better, Fertility Master Circle is where we go deeper. Every week, a new module. Every module, one more thing you will not have to guess about it. You do not have to figure this out alone, and you do not have to start from zero. The link is in the description. How old are you? And when did you first start thinking seriously about your fertility? Write it below. I read every comment.